Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another one of our COVID conversations. One of the questions we sometimes get is, how is a person in the community, an elected leader, a doc in the community, somebody who works in healthcare, to know what the current situation is with COVID? We all hear little snippets in the newspaper or snippets on the radio, but where would you go to get the information? And that is a great question, and there's something we consider early on. So for the past 2 years, we've been doing twice weekly briefings for people in the community who are interested. We get mostly doctors, elected officials, and school people who are on call, but we've been doing it now for many, many, many months. And so what I thought we would do today is to give you a sneak peek at what we look at. And if you like it, then you can tune into our Monday and Friday sessions. So let's see if we get started here. The Friday sessions are accompanied by slides, and here are the slides. So the next slide, we'll get to the next slide here, shows cases in the world. So when you look at this slide, you can see the pink area, which is the number of cases reported each day, and the red area, which is the smooth 7-day average. So you can see, starting from the very beginning of the pandemic in February of 2020, there were a low number of cases, which then peaked a little bit in December of 2020 when we had the Alpha outbreak, in the middle of May when there was just an outbreak of many things, in September and October when there was Delta, and then in January through March of this year where there was the BA1 Omicron. There's another little peak where there's BA2 Omicron, and then it goes down. So you can see that the total number of cases now in the world are about 480,000 cases a day and about 1,500 deaths. Still a lot of deaths and still a lot of cases, but you can see that overall the number of cases is about at the low point we've had since the fall of 2020. Looking at the right here, you can see we've had 500 million reported cases and 6 million reported deaths. So this really is quite the terrible pandemic. The next slide shows how cases per capita have changed, and you can see this kind of follows the previous slide, but it breaks it down by continent. And you can see right now in the US and Canada, cases are probably steady, but going down pretty much in the rest of the world. And that really is a good sign. The next slide is a map of the world, and this map of the world shows the amount of heat in each of the areas. You can see the areas that are in white have reported no cases, either because they don't report cases like in Ukraine, or there just have been very few cases. The light yellow is a low number of cases, and then as it gets darker, you can see more and more cases. You can see in the world now that there are places in Africa that have reported no new cases, going all the way through Australia and New Zealand, which are reporting a very high number of cases. So Australia and New Zealand had very little disease in the beginning parts of the pandemic, but they do have high levels of vaccination. They now are having a fairly high level of disease, but not very many hospitalizations and not very many deaths because they have a high level of vaccination in those areas. The two areas that are kind of unknown, North Korea, there are news reports that there are big outbreaks in North Korea, but they've reported no cases, and mainland China. We know that mainland China has done lots of lockdowns and had some cases, yet they're reporting a very low number of cases of COVID. I don't know what to make of that. You can see in the rest of the world, there's a little bit of disease in Europe, especially Portugal, and then cases in South America, especially Chile. So during this whole pandemic, Peru, Brazil, Bolivia have really suffered mightily during this pandemic and have had a relatively high death rate. The US is kind of in the average purple range. Canada, which had previously been higher, is now going down. The next slide looks at the number of cases and deaths in two countries that we've been following very carefully. The United Kingdom is a place that we follow very, very carefully. And the reason we follow that carefully is that if you look at the United Kingdom's case counts and then the US case counts, they pretty much match, although the US case counts are 6 or 8 weeks later. So in the US, we had an alpha spike in the spring of 2021. We then had a Delta spike in the fall, an Omicron spike in January, February, and then another BA2 spike here. And so right now, the UK is having a low number of cases, and only 12 cases per 100,000 people per day. And that's kind of the measure we follow, the average number of cases per 100,000 people per day. And in Douglas County, that's pretty easy because in Douglas County, we have just a little bit more than 100,000. And this is a good measure. You can see in the UK, the number of cases is really very low. It's as low as it's been in almost a year. And that's good. And the number of deaths is also really quite low and continuing to decline. The next slide shows South Africa. Now, South Africa is an area that we look at because South Africa was the harbinger of some of the outbreaks we've had, including the South African variant in the spring of 2020, and then the Omicron variant, which really emerged in Southern Africa in December of 2021, going into January of 2022. You'll see in South Africa, the case counts are very evenly spiked. And they had their Alpha, then the South African variant, then they had Delta, then Omicron, and another little spike recently due to the BA4 and BA5. This BA4, BA5 is starting to spread in other places, but has seemed to already peak in South Africa. And this would suggest that if the rest of the world has a BA4, BA5 spike, it is going to be something, but it's not going to be nearly as high as the previous spikes. The next slide shows what's happening in the US. So in the US, you can see that there was a spike, the alpha spike in December and January of 2021. Then we had a Delta spike in July through October. Interestingly, in the rest of the country, it was pretty low. It was really high in Oregon. And then in the US, a big Omicron spike in the early part of this year. It then went down and has now come up again due to the BA2 and its subvariants. And you can see when you look at that, it's kind of flat over the last few weeks. So we may be nearing the end of the BA2 spike. You can see down on the bottom in the gray, the hospitalized cases are up only slightly, and deaths really have not budged very much during BA2 spike. And that's a really good thing. The next slide is, again, a map of the US showing heat. And you can see from this, there are scattered counties throughout the country that are dark, but no really big areas that have lots of disease. The places in the US right now that are having the most disease are in Puerto Rico and in southern parts of Florida. Hawaii is also struggling a little bit with cases. Again, they did not have lots of disease early on. The next slide is a little complicated, but follow this with me. So we've been following which variants are causing disease. And this waterfall graph shows which variants are now causing disease. So if you go to the very right side of the graph, you'll see that there's multiple colors. The light blue is the BA2. The darker blue is the BA2.12.1. And then there's a little bit of BA2.3 and a little bit of BA2.9. You can see in the very top right, there's just a little bit of light green and red from the BA4 and BA5. And this suggests that in the US, BA4 and BA5 are starting to take over as the predominant variants. This is just really looking over the last couple of months. But if you look in the past, this is how they all start. When a new variant comes in, it starts out just as a little bit and then begins to take over. So I would not be shocked if BA4 and BA5 were the predominant variants in the next 30 to 60 days. The next slide looks at pediatric hospitalizations. And this is something we follow carefully because pediatric hospitalizations have generally been pretty low with COVID. But you can see in July through October of 2022, there was a little spike with Delta and then a huge spike in the beginning part of this year when we had Omicron. However, now you can see in the BA2 spike, not really a lot of pediatric hospitalizations, and that is really, truly a good thing. The next slide looks at the same kind of graph from Oregon. You can see in Oregon that we had a little bit of an alpha spike in the winter of January 2021. We then had a larger spike with Delta in the fall of 2021, and then our biggest spike in Oregon with Omicron. And right now the cases are probably stable. We're probably right in the middle of the BA2 spike here in Oregon. When you look on the bottom, though, the number of deaths really hasn't moved very much during our BA2 spike. And that's because by this point, many people have immunity either from infection, from vaccination, or from both. The next slide looks at a heat map for Oregon. And this heat map for Oregon shows, again, the same strategy, that the places with most cases are dark red. And in Oregon, Eastern Oregon is a little hard to follow because there are so few people that even just a few cases changes their color. But when you look in Western Oregon, there's really no hot spots at this point. Douglas County, you can see on the map, is kind of quiet. The next slide is another graph that shows the different variants in Oregon. And you can see in Oregon that at this point, it's mostly BA2, BA2.12, and BA2.3. Oregon has had just a few cases of BA4 and BA5. But when it comes to the rest of the country, it may well come to Oregon in the next few weeks or months. The next slide looks at hospitalizations. And here's, again, the hospitalization trends. We had a bit of a hospital spike with Alpha, a little bit in the summer of 2021, and then a huge spike when we had Delta. And this was the time the hospitals in Oregon were really quite overwhelmed. And then another large spike in hospitalizations with Omicron. At each of these other spikes, you can see is the number of total cases spiked in the dark blue, that the number of people in the ICU and the people on ventilators also kind of spiked. But now we're having a little bit of a spike due to BA2, but really not a big increase in the number of people in the ICU or people on ventilators. And again, that's because people who either have immunity from vaccine or from previous disease don't seem to be getting as sick. And that really is a good sign. The next graph shows the cases that are in hospital because they have COVID, and in gray, and then the ones who are in the hospital and they have COVID, although that's not the reason they got admitted to the hospital. So you can see early on, almost all of the COVID hospitalizations were for COVID. But as we move later on, some of these hospitalizations were for people who had COVID, but didn't get hospitalized because they had COVID. So for example, it's a mom who was pregnant, needed to come in the hospital to deliver a baby. She got tested and was positive for COVID, but she wasn't there because she had COVID. She was there because she was having a baby. And you can see that early on, when much of the discussion that, people really aren't in the hospital for COVID, and they made all kinds of distracting conversations. That wasn't true. In the last few spikes, as more and more people get immunity, you can see that more and more people are in the hospital for other reasons. And right now, if you look, you can see that of the people who are hospitalized, the majority of people who are hospitalized have COVID, but they're not hospitalized for COVID. And I think that's what we've seen. When I looked at the Mercy numbers today, there was only one person in the hospital who was on oxygen, meaning that the people were there for other reasons. Either they tested positive when they came in to deliver, they were there for behavioral health reasons, or they were there because they had a positive test on a pre-procedure test. So again, this is all good news. Not a big hospital spike now, not very many people in the ICU or on ventilators, and not that many people in the hospital for COVID, but they may have tested positive. The next slide shows our influenza. So we're not just following COVID right now, we're following influenza. This has been a really unusual influenza year. Usually influenza peaks in Oregon in January and February. This year, there was not very much disease in January and February, but starting in March and April, the amount of disease went up. Usually in Oregon, there's no flu left by April, and now you can see that there's still a relatively high amount of flu in the state at this point. And certainly in my practice, I see occasional kids who are positive for COVID and occasional kids who are positive for flu. So both COVID and flu are co-circulating at this time. The next slide shows the Douglas County data. So this looks a little hectic, but let me tell you what's going on here. So the blue lines, the blue spikes, are the number of cases for each day. You can see in the last few weeks, the people are not sending us weekend data, so there's a little bit of discontinuity there. The blue dotted line is the 7-day rolling average. The yellowish lines are the number of hospitalizations, and the orange dotted lines are is the moving average number of hospitalizations. So again, going back, you can see we had not very much disease until our big Delta spike in the fall, and that was a big spike and a lot of hospitalizations. We then went down and then had Omicron, and with Omicron, a big spike in cases, although a smaller spike in hospitalizations. And now we're in our BA2 spike. We're having a moderate number of cases, but really not much in the increase in hospitalizations. We're at about 29 cases per 100,000 per day, which in the entire course of the pandemic is a sort of a mid-range number for Douglas County. So we're kind of in the mid-range here. And again, we think in Douglas County, these are mostly BA2 variants. The next slide is the new developments over the week. So each week we go over what's happened new in the week. So one of the things is that the vaccines made by Pfizer and Moderna are up for review in mid-June for the age group 6 months to 4 years. I think the data on those looks pretty good, and it'll be interesting to see what the FDA suggests about that. I think they'll get approved, and if they do get approved, the vaccinations could start as early as June 23rd, just a few weeks from now. Another announcement yesterday is Moderna announced a booster vaccine that contains not just only the original strain of the virus, but also the Omicron strain. So while the first was monovalent, that is, it had one antigen, this is now a bivalent vaccine that should provide good protection against both the original strain and the Omicron strain. It could be available this fall, although I will tell you, during this entire pandemic, we've been incredibly careful when people make time predictions about when things are going to be available, because they've rarely been right. Another new development is that the FDA approved the use of Novavax. And so Novavax is a protein-based COVID vaccine that does not rely on RNA technology. It is like vaccines were made in the past, where you would get a protein, you teach yeast how to make that protein, then you'd collect enough of that protein, put it in a vaccine, and give you a vaccine. So this is similar to, for example, how the hepatitis B vaccine is made. It's a proven vaccine technology, but it's slow because it takes a long time to teach those dumb yeast how to make proteins. And so it's there. It's going to be out in limited numbers. But for people who wanted to get vaccinated but wanted to avoid the RNA technology, the Novavax could be a good option. The next slide is just a capsule of where with the current situation. I think we're in the midst of a small COVID surge due to BA2. People always ask me, are we out of the woods yet, or is this pandemic over? Well, pandemics are not really over until things become predictable, and they're clearly not predictable at this point. And we're not out of the woods, but what I'm telling people is I can see the clearing at the edge of the woods. So I think we're not too far from being out of the woods there. I will tell people that influenza is still out there, so it's not just COVID you need to worry about. It's also influenza. That vaccine is still really quite effective in preventing serious disease. So when we look at the people who are hospitalized and die, it's almost always people who are either unvaccinated or are vaccinated early and then not boosted. So for people who are boosted, we're seeing a relatively low hospitalization and death rate. So we're still recommending the vaccine. There is plenty of vaccine available. The other thing is that there's plenty of antivirals available. So antivirals come in oral medications or injectable medications. The oral medications seem to work very well against the Omicron strain. We've not seen any big side effects from them. So we are recommending that people know that there's plenty of antivirals out there, and if they get sick, to avail themselves of that. So then we always end with our best advice. So the next slide shows what our best advice is. So our best advice is get vaccinated. If you're not vaccinated, if you're already vaccinated, get boosted. if you're gotten the first booster and are eligible, get a second booster, because we know that every additional shot gives a little bit more protection. Most importantly, if you're sick, stay home. Now, this is a tough time of the year because there are some allergies out there with trees ending and grasses starting. And so it's going to be a little hard to know sometimes about whether this is allergies or whatever. The things that are a little different is with allergies, you should not really get a bad sore throat. With allergies, you shouldn't get a lot of muscle aches, and you should never get fever. So if you're sick, stay home until you get a better idea of what's going on. Because what we've seen during this pandemic is that many people go to work thinking they've just got a cold or allergies, then later find out they have COVID and giving it to all their coworkers. So if you're sick, stay home. The second is, if you do go to the doctor and get tested, I would recommend that you get tested for both flu and COVID, because they're a little hard to tell apart without a test. And there are plenty of flu tests and plenty of COVID tests out there. And then we say to people, if you're positive for either flu or COVID, talk to your provider about getting an oral antiviral medication. Again, these are quite effective at reducing severe disease. So if you do get sick and you're positive for flu or you're positive for COVID, talk to your provider, because they're good antiviral medicines for both, and they're widely stocked in town. And then the last piece of advice is, at this level of disease, at 29 cases per 100,000 per day, high-risk individuals might consider the use of masks in high-risk situations or delaying high-risk adventures. So, for example, this weekend, I'm going to the American Medical Association meeting in Chicago. They have about the same amount of disease in Oregon. And so, for example, we were scheduled to have a dinner. We're going to have that outside, which I think reduces the risk. And when we have indoor meetings, we'll be using medical grade masks. So we're not done with COVID. We're getting there, but we're not done yet. And we're asking people still to be safe about that. So this is the briefing that we do for medical professionals, government officials, school officials, and anybody else who wants to join us. And we do it twice a week. On Friday, we do it with slides. And this, I think, is a good way to get that information. We try and make it unbiased. We try and make it as apolitical as possible, and try and stay right up to date. So again, this is what people in the community have had available over the last year. If you want to join in, go to our website, and you'll see how to do that. So again, this is Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County. Thank you for joining us, and we'll see you again next week.